Good afternoon, everyone. I hope everyone's blood sugar levels are back up and everyone got a bite to eat. I'm delighted to introduce Dr. Eric Miller for this afternoon's session. Dr. Miller is a biofeedback therapist and also a board-certified music therapist. His recent 2011 book is titled Bio-Guided Music Therapy. He's an adjunct faculty member at Immaculata University and is also the Ott Lab for Music and Health Coordinator at Montclair. He has lectured at the Naropa Institute as well as Bryn Mawr College, and his international presentations include sessions at the World Music Therapy Congress in Seoul, as well as presentations in Taiwan, Switzerland, France, and Italy. So he's got some good frequent flyer miles, it looks like.
I think I used them.
Dr. Miller serves as Executive Director of nonprofits Music for People and Expressive Therapy Concepts, and he also founded the Biofeedback Network. And if you'd like to know about his badminton background, you can look into your program. So please help me welcome Dr. Miller.
Well, thank you very much. It's a pleasure to be here, and I'd like to start by thanking Dr. Combo and Dr. Arthur Harvey and Dr. Roy Kennedy for making this conference happen. I think it's a very important thing for people interested in music and science and the impact of music to get together and share ideas, hear what each other is doing, and find ways to collaborate with each other. Critical for the growth of the field and for our own personal understanding. The intro coda music that you heard actually was Dr. Clint Goss on the Swiss Hong drum there that we were listening to, and that was one of the bed tracks that I often use as a bed for live, real-time physiological feedback or tonal feedback. But we'll get to that a little bit later. Those of you that came in late didn't get to hear it. We'll move on to it later. Now, I have a bunch of didactic PowerPoint stuff, but I really want to be sure that we get into some of the hands-on, experiential, and experimental part of this. So if I start going on too long, just holler at me. But I think that for starters, what I'd like to do is, while I'm talking, if someone would like to just be hooked up to a physiological measure here, you don't have to do anything. You can just sit and we can monitor you on that screen just to have something live happening while this is going on. I think that would be nice if anyone would like to volunteer. You don't have to come for the whole time. You can just come up for like 10 minutes and then swap out with someone else. Yeah, sure. So you'll take that seat here, and we'll just the little finger sensor on. We'll talk about the finger sensor later. There's a little Velcro adjust, and we'll just let it sit comfortably on your knee. And let me see whether we're getting a signal or not. Move off the screen. So it looks like something's coming up there. And can everyone see this little monitor? Later on, we'll switch the physio to the large screen. But for now, we'll just kind of keep an eye on what's happening here. You've got a measure of heart rate over there on the left, and you have a measure of skin conductance or electrodermal response on the right. There are a couple other measures that we can get to with that, but we'll keep. The other thing we'll do so that we can track any change over time is bring up the trend graph And I'll take a data point every couple seconds. Length of that, so you can see 4 seconds. Give ourselves a little more room. So you've got your galvanic skin response here, heart rate variability in the center, and heart rate proper on the lower graph.
What is the galvanic skin response?
That's the skin conductance. And I'll be talking about that. It's a nice segue. I'll be getting right to that. Okay, so here we go. Bio-guided music therapy. It's a research poster that you'll be able to see in the poster area once we get that rolling. And the real distinction here with bio-guided music therapy, at least the way that I think about it, is that we're utilizing real-time physiological data to inform live music therapy intervention. The key is that the data that we're seeing is live in real time, as we're seeing over here. Data is coming in every couple of seconds. We're seeing changes in heart rate. We're seeing heart rate variability. We're looking at galvanic skin response. And with a number of different devices, we could be doing brain waves and we could be doing many other different measures. But the idea is that this information is informing me as a music therapist how I want to be playing my guitar, what tempo I'm going for. Nacha talked earlier about improvising with the rhythm, with the feeling. Well, here we're taking the physiological motion, rhythms, and changes, and we're improvising, we're jamming with body response in real time. So that's the take-home message, is that the difference between bio-guided and some other approaches is that we're using real-time physiological data. If you have that, you can all go home. I just threw up a couple of nice articles that help support the idea that neuroscience is making headway with looking at the impact of music as far as neurological function and structure is concerned. So here we have a 2011 article in Nature Neuroscience that shows anatomically distinct dopamine release during anticipation and experience of peak emotion to music, the Salampour article. And they talk about music being able to arouse feelings of euphoria and craving, and they found endogenous dopamine release in the striatum at peak emotional arousal during music listening. There's one nice article that contributes to support some of the work we do. Journal of Neuroscience, 2009, Hyde article, musical training shapes structural brain development. And they say here, we demonstrate structural brain changes after only 15 months of musical training in early childhood, which were correlated with improvements in musically relevant motor and auditory skills. I've got a handout, by the way, that's up online that anyone can access. If you go to biofeedback.net and click on the link to handouts, materials for Dr. Miller's music therapy students, you can get to all this stuff. And a nice 12-page handout with pretty pictures and stuff.
Thank you.
And soon it'll be coming also to the bioguidedmusictherapy.com site. So if you forget the other one, you'll be able to go to bioguidedmusictherapy.com and be able to download the handouts. 2009, the Janke article, The Plastic Human Brain. This is another good one. A review of brain plasticity in musicians from the University of Zurich found musical experience can change gray and white matter densities, as well as activation patterns in brain areas specific to a controlling task. And as Elena pointed out earlier today, there have been a lot more recent studies that have come out, 2011, 2012, Sartori has put out a bunch of studies, and there are many new studies that are happening as we speak and have just come out. So that's getting to be old news, but important to know how we try and get familiar with who we have here. Is everybody familiar with the Hans Jenny cymatics stuff? You're all familiar with that? Okay, so I can breeze over. You've seen the pretty patterns and shapes that water and sand and lycopodium make when he introduces frequencies. All right, so we're going to move ahead. So we have a limited time. We want to get to the hands-on stuff. Speaking of which, let's take a look over here and see how we're doing. On the top, we see this curve in electrodermal response. So we start with a kind of a relaxation pattern, getting more relaxed, and then right about here, we're looking at 4-second intervals. It started to increase. And something is triggering. Or what's your name? Kristen. Something is triggering Kristen, and her body is activating. We could see at that point. I forgot to look over to see exactly what it was, whether it was, or you might be able to clue us if you were aware of what it was that triggered your body to start to activate at that point about there. But now that's all pretty low level compared to where we're at now. Now that we're focusing on you can see this sharp spike in electrodermal activity. It shows she's got a very reactive and sensitive nervous system, and that's wonderful. A great thing to be able to work with. When you have sometimes in depressed patients, you'll find there may not be very much reactivity in the electrodermal response. You may have to look for another response. So we've got a very alive, active person here. So if we were playing music, we'd be able to see very quickly is the direction I'm going is, my major chords, helping. Assuming if our goal was relaxation, is that helping? Is the minor helping? Is my tempo too fast? Is my tempo too slow? And we can see reaction right off the bat. And we're also noticing on the second graph here, some increased heart rate variability, which is the healthy heart rate variability, a healthy response of the body. So we're seeing maybe some deeper breathing or longer breathing patterns here. Okay, so we're going to move forward. Basic diagram of brain info. Well, actually, this brain pattern, I took a couple of diagrams that Dan Levitin did, and he didn't really put together what I wanted to see when I was reading his book. I wanted to see the brain functions, the areas, and the musical function that went along with them on the same slide. So I overlaid and got something close to what I wanted to see, which was what is the area of the brain and what musical functions are occurring at that in that area. So we have, like say in the rear, visual cortex, the occipital. We've got visual cortex, and he's got functions such as, or activities such as reading music, looking at a performer's movements, including one's own, things that are happening during a musical activity and where they're happening in the brain. So that's in the rear of the visual cortex. You have decision making and analytic stuff happening in the front, the prefrontal cortex. Memory for musical experiences, hippocampus, cerebellum, movements such as foot tapping, dancing, that kind of thing. And of course, that could be fleshed out and made more specific. Now here are some of the physiological measures that we use in biofeedback and that you can also use in bioguided music therapy. And we'll be going over these very quickly as we move forward. Some of you are familiar already. Are you familiar with EMG, electromyographic muscle tension readings? No? Okay, we'll move forward. We'll talk a little about it. Well, funny you should ask. EMG. In biofeedback, use EMG. We can use it for tension headaches. He reads muscle firing. So this is my EMG sensor, and I've gelled it up. For a tension headache, I might put it on the frontalis up here and get readings, like we're seeing readings over there, or it could be put on the traps, and you get the whole frontal area read down from the frontalis down to through the sternocleidomastoid and the traps in the back. If I put it on the traps, you're going to get less frontalis, obviously, if you don't put it here. It's used for tension headaches, neck and back pain, hypertension, anxiety, general stress, phobias, neuromuscular reeducation, stroke, and bruxism, and TMJ, temporomandibular joint syndrome. There are probably other things too. This is a great chart that I really enjoyed seeing as I was doing some of my early biofeedback training with Dr. Jack Hartshee in Jacksonville. And at the top, we've got a picture of a raw EMG. No mouse. Raw EMG signal there, rectified in the second graphic with the bottom chopped off, then filtered so we have a smooth half a sine wave. And then the bottom, we assign our musical notes, and voila, we have the musical representation of a muscular signal. I just thought it was a really nice graphic representation of how we do this. And over here, we could actually go in and assign a musical note in similar fashion to that electrodermal, which we see is gradually coming down. Let's see what we got here. Yeah, why don't we do that just for fun? Now we're going to just play. We're going to assign it to valence, which is the direction of change. And it just resets so that we'll be able to hear something, hopefully. All right. No, it was working earlier. We'll see if any sound shows up. No, there we go. All right, so now we'll be able to hear her response as well as see. I don't know if people can see that valence graph in the middle. But if you can't, you can just listen for that tone going down, and you can hear her electrodermal activity, which we think of as kind of like a stress meter. It's an easy way to think about it. Now, sometimes don't be alarmed, because sometimes if she gets too low, we have it set so that it'll come back up so that she can continue to go down. Because if you go too low, then there's nowhere further to go. Okay, now she's going up a little. And we see a little bit of that activation right there. So we'll just take a listen to that while I continue. You okay? Anything you want to share with us?
It's like, welcome. Welcome to seeing what's happening inside of me.
Yes, for everybody else.
Yeah, this is I'd like to give you a lot of credit for taking a risk and doing this. It takes a lot of courage to come up and have your physiology on display at a conference like this. You're doing great. Round of applause. Okay, we were just talking about muscles, and we've got lots of muscles in the body. Don't need to go over that for you guys. Temperature feedback in traditional biofeedback is used for migraine, Raynaud's disease, where there's a difficulty with peripheral vascular circulation. Nice low tone. Very good. Asthma, hypertension. And here we've got electrodermal, which is what we're looking at now. And with electrodermal activity, the sweat glands respond to anxiety and perceived danger. This fight-flight reaction is measured by the electrodermograph, EDG, and training can assist with the following. Now, I would just point out that those of you familiar with GSR we're talking about pretty much the same thing, galvanic skin response, except that galvanic skin response is a measure of resistance, whereas electrodermal response is usually considered a measure of conductance and measured in a very clever unit. Does anyone know the measure that electrodermal response is measured in? How about galvanic? Galvanic skin response, of course, is measured in ohms, measure of resistance. But what is the measure of conductance that was designated for electrodermal activity, EDA? Same thing, EDA, EDR, electrodermal reaction. Nice low tone, that's great. But what they did was it's MOHs, M-H-O, and they inverted the letters of ohm, O-H-M, and they created MHOs, MOHs, and those are the measure, that's the unit measure of conductance, electrical conductance. Cute little trick. Electrodermal feedback is used in guided imagery, and in fact, one of the processes that I outline in my book is an interactive guided imagery process where you have different sections, so to speak, or phases of an imagery. Similar to hypnosis, you have an induction phase where you're getting acclimated, or you're moving down into a lower state, and then you have an acclimation stage. You have a work phase, and these are very pliable. You can really create different things if you are attuned to what kind of music your client responds to for those different kinds of activities, and what's best for say working on a clinical issue, what's best for straight relaxation, and then something to bring you up at the end, to bring you back to normal reality. Stuttering, asthma, stress. General stress is a big one. Phobias, and HRVs. We have people here that are familiar with heart rate variability. This is a healthy heart rate variability, and it's a little intimidating because I know we have some experts here in the field that are very familiar with, just come from workshops on heart rate variability, artifact reduction, and that kind of thing. So, but so feel free to correct me if I make any errors. There are a number of ways in fact, there are many ways to measure heart rate variability. From the electrical or EKG standpoint, we're looking at the variation between the beats, the heartbeat. So you have a point in a cardiac cycle, and from that point to the next, R to R, is a certain time length, maybe 0.8, 0.6 seconds. And the difference from one heartbeat to the next that difference is the variation. And if you're doing research, you may want to look at the standard deviation of that difference, SDRR. And if we want to get even up to the gold standard, we have SDNN, which is the normalized algorithm for the difference in heart rate. Now, what we do, what I'm doing here when we do HRV, is the poor man's HRV, which we're taking it first of all off a pulse meter. So we're getting a pulse, and we're deriving heart rate off the pulse. So for clinical use, what I'm doing is we're taking the maximum heart rate minus the minimum heart rate over an estimated breath cycle, and we come up with a number in beats per minute. And we'll get to that in a second here.
May I ask a question?
Yeah.
What does the heart rate variability relate to in terms of?
Coming up.
Okay.
Coming up. Good question. So let's try and get a handle on what this is first. Heart rate variability consists of the beat-to-beat changes in the intervals between consecutive heartbeats. All right. Low heart rate variability means not much change. Low heart rate variability is correlated to a number of medical and physiological diseases, such as anxiety, from Friedman 2007, mild hypertension, panic disorder, a number of researchers, diabetes, and diabetic autonomic neuropathy, Staus 2003. Low HRV is also a prognostic indicator of sudden cardiac death. So if there's very little change, if you're very flatline, the HRV changes, there's a good chance of impending mortality. And, if I can read this bottom one, it's also a predictor of mortality rates in survivors of acute myocardial infarction. All right, so we're ready to see what heart rate variability is over here. All right. Well, it's our second graph here. So we've seen a section here, very nice heart rate variability. I'm not sure what triggered that. Overall, we're in 2, 3, almost 4. Can you breathe a little bit, please? Thank you. Very good. Let's take a look at meters. All right. And how many of you can see this meter graph from where you are? Not too many. All right. We'll project later. We're running, HRV is running at 4.17 now. And this is a very kind of rough and dirty measure so we can see something live in real time. It's going to change about every 30 seconds. It's going to take a window. It's going to take 3 windows, actually, and give you an average heart rate variability over 3 10-second windows. So it's going to go 10 seconds, see what the maximum heart rate is minus the minimum, get a number. It's going to do 3 of those windows, and boom, give you an average. Just drop to 2.27. All right, so you can work on that. You can look at that low, that low one, and we'll talk about some good stuff now. Okay, HRV biofeedback training to raise HRV has been found to have various degrees of effectiveness in the treatment of asthma, PTSD, hypertension, anxiety, COPD, recurrent abdominal pain, music performance anxiety, fibromyalgia, major depressive disorder. I just love this cover because it really kind of captured something about our society. Because actually my students at Montclair do a much better delivery of this than I do. I can go up and pitch faster. You're busy, you're very busy. You're overbooked, overstressed, overburdened. You're on a schedule that increasingly represents the baseline tempo of American life. And having loosely regarded the candy fat level of percentage activity, it's impossible for anyone to say except a state of mental and physical overload. So that's you're very busy. This is like normal life here on the are we out of the Eastern Seaboard yet? Well, there's a lot of New Jersey people here. So,
Yes.
so I'm thinking maybe not so much in Athens, but New Jersey kind of captures some. Okay, stress, you guys are all familiar with stress, so I'm not going to really get into stress too much. It's brought on by physical demand, emotional demand, perceived danger, ambiguity, habituated response, cognitive interpretation. And let's see how we're going. Okay, hanging in there, 3.5. That's nice. We'll tell you what, we'll give you a break. When we get to the end of this segment here, you can go back to your seat
Pass off.
and you can pass it up. You can see, interesting, look at these patterns here. Electrodermal response. I'm going to say your task now is just see what you can do to bring this top one down, the electrodermal graph. See what, just look at it.
What should I do to bring it down?
Listen and feel. And if we were in a session, it'd be playing music with you, or I'd go over to the meditation screen, we put on the Kodo piece, you know, maybe, let's see, what if we did, you know, maybe we put a background track for you. So that's the background, and your tone's going to ride over the top. There we go. And then you're going to be close to D minor, force D minor checkbox checked off. We could also reverse it. Feedback loops. We've got two major feedback loops that we use in bio-guided music therapy. One where the client and the therapist are getting the feedback, which is what we have right now. She's seeing and hearing her own physiological response. Well, we've got a musical bed track. Now I could be playing live, or we could have a music therapist playing live instead of that bed track, or with the bed track, responding directly to your tone. I'm just doing this for example. There are many ways you can go with this, man, but it's as limitless as your creativity. And the other model is where she doesn't get any of the feedback, only the therapist. Only I get the feedback. So I would be playing, I get the numbers, and I get more sounds, and she doesn't get that. She just hears what comes back through me. These are the two models, the two feedback models. Okay, let's stop that. Kind of a fun yin-yang chart. I'm going to move over this one because I know a lot of you are familiar with yin and yang, but the main relationship here too is that there's a direct connect way down at the bottom. I was looking at these interpretations of yin and yang, and I found one that showed 2 yin was related to a pale face or hypoactivity, and yang related to red face or hyperactivity. There's just such a great connection between what we're doing here with say, nervous system activation and parasympathetic response where the nervous system's calming down. We have that parallel in Chinese medicine. That's on the poster when we get the poster presentations. You'll be able to see that. Again, sympathetic nervous system, parasympathetic nervous system, seesaw, activation, deactivation. Now, this is just one measure we're using. We could also do a brain waves. I usually carry an EEG pendant around with me too, so if we ever need to do emergency brainwave work, we can do two channels. That's wireless. Goes wireless into the computer, not wireless to the head. You have to use wires to the head, but then it's wireless over to the computer. This, by the way, that she's working on is an ancient mind drive, which a friend and I started coding some software to, which is this, so that we could actually use it for biofeedback. This is an old J&J. It's the second incarnation of the i330 which allows for many different biofeedback modalities. So there are a lot of instruments you can use. You can use the fancy Nexus 10 or whatever series they're up to, 20, for live feedback. So I'm not trying to sell a device. There are a million devices you can use to do this. All right, I think we're about ready for a break. Let's see how trend graph. Yep, there we are. And look at that nice relaxation curve at the end. Came right down, 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 down. Do you have any idea what you did to do that, or what?
Well, I started just thinking. I was at a meditation retreat for 17 days, so I started just with my eyes open, just trying to meditate.
Eyes open meditation. Was it a mantra meditation, or was it what kind of meditation was it?
I practice something called the Alexander technique, so I just thought about releasing my neck and releasing my shoulders and honing in on the breath. And just trying to be present and hearing what you're saying and not going with any thoughts that might be going through my head.
Nice. Well, it worked nicely. See that curve. One thing about electrodermal is that it's very easy for it to spike up, and it takes a while for it to come back. It doesn't come back down as quickly as it goes up. So there's a decay factor. So it's nice to see that when you got triggered and your nervous system went up like that, that you had a technique of something that you were able to do to bring that physiological level down. And we could see it on the graph. And I would just make the point here is that one thing that, for those of you that are music therapists, is that being able to show what happened in a session physiologically can be very powerful if you're working in a hospital, you're working with insurance companies, to be able to have a tangible representation in the language of mainstream medicine that shows what you're doing and what happened and how things work out. It's very nice to be able to print something like that out and show here, circle here, patient used mantra meditation, and we see this increase in HRV or this decrease in electrodermal activity can really support what you're doing in certain situations, can be beneficial. All right, so you can release that. And if there's any other volunteers that want to come up to, anyone's welcome to. Yes, please. Well,
pick the best one.
Pick the best one. It looks pretty good. Most of the Velcro adjust. I don't want it too tight. I don't want it to cut off circulation. Restrict the capillaries too much. You feel all right? Yeah. Okay, just put it gently on your knee. Yes.
Do you have to be stationary to get a good read on all these things, or are there any of these measures that can be done while somebody is moving?
Ambulatory.
Active in some way?
Yeah, I heard recently about a system they were developing at MIT, this vest that gives you all kinds of measures, and you get all kinds of great ambulatory readings with that. I haven't tried it yet, but there are ways to get ambulatory. Maybe Alex has some information.
No, we're searching.
Okay. All right. And some of it depends on what activity you're doing.
Right,
like there,
of course. If it's
yeah,
something
I mean,
that's intrinsically read.
right. So there are things that I can do with with an EEG sensor on my head, and this thing clipped to my jacket, and I can be walking around or whatever. But with EEG, you're always going to have an artifact issue about eye blinks and all that kind of stuff. So you have to have a very good algorithm or system for artifact removal.
Yeah.
But most of the systems, actually, you're going to have an artifact removal issue with ambulatory, just because you're introducing a much more complex level of interaction with the body and your physiological reading. Let's reset this. So, reset. All right, we've got signal. So you're at 192 there, 199, 204. It looks like it's going up. 211. Oh, there's a sound. 19. Heart rate's over here. Nice. Okay, we can hear you now. Okay, here's our meter, so you can see HRV at 3.55. You're welcome to breathe a little bit if you want. Let's see if we can get back to our trend. There we go. We'll turn off your sound for the moment and get back to our PowerPoint, and I think maybe we'll just do like 5 or 10 more minutes of PowerPoint and really get into live stuff. And I want to give you guys a chance to try out your experimental desires with physiological equipment and music. Do you have any piano players here, by the way? Good. Okay, we've got a piano. We may need to employ you. Deltas are the slow waves, or stages, 4 stages of delta sleep. Long, there's 0 to 4 hertz. Theta is usually 4 to 7, usually related to imagery, or sometimes some people relate a more mystical state of consciousness with theta. In the case of ADHD, theta is related to kind of spacing out and not paying attention. Alpha, light meditation, you get there easily with your eyes closed. Sensory motor rhythm is a low beta, usually in the 14 hertz range. Wideband SMR, 12 to 15, usually. You can ignore that chart. Beta, 16 to 24. High beta, 24 plus, and there are differences of opinion on where gamma is, but it's higher than high beta, so maybe 35 or 40 hertz up to 60. Any gamma experts out there? Yeah, okay, okay, great. And our gamma expert says it's higher than beta. Here's a screen developed for ADHD work. You can see we've got an oscilloscope on the left showing theta in blue, muscle tension, EMG, measured at the poor man's EMG in the 25 to 35 hertz band, which is the old Lexicor algorithm. And a raw signal in green, and you've got running averages down the bottom. So you've got average theta there on the left, the session average at 15, sensory motor rhythm at 5.1, EMG. We know we're getting a good reading because EMG is down at 1.5. Now let's see if we can fire this up. I think it's on the next screen. Okay, yeah, this is here's the video of it. Star Wars neurofeedback. Well, maybe we won't see it. I guess we don't see Star Wars neurofeedback. We're in trouble now. just like that. Cool.
Good job. Great. Beautiful.
Here's that meditation screen that we were working with on that small computer. And as I switched at one point from the coda cello over to the ocean sounds. These are just some pre-programmed bed tracks that I put in, but of course you can use anything you like for a bed track. I got a couple of synth things, different ways to feed back the physiological tones too, which we didn't really get into. I was just using one MIDI patch with 127 MIDI patches, and lately the very latest thing that I've been working on is, instead of feeding back a MIDI patch, what about feeding back, say, a live Native American flute phrase, a brief phrase, and as electrodermal goes up, you get a little bit of a higher phrase coming back from that native flute, that live instrument, rather than that sort of tone that we were hearing earlier. So here's the, well, you know what, we'll demo that a little bit later. Keep that, hold that thought. Here's some bed tracks from the Spirit Grass album that I used. See if any of them play. In fact, we can give some tones on top. We'll put here. Just refresh all this reset. And I need a mixer. It's not. Well, I guess we have to wait for it to play out. Let's try to change our sounds here, see if we get something coming out. Oh, something triggered you just here. You see that? We're at 2-second intervals now, so it was just about 2 minutes ago. Any idea what that might have been? What happened 2 minutes ago that kind of elevated your nervous system?
I mean, there's definitely the difference between everyone paying attention to you, and then when you look over here, then everyone, I imagine, looks over here. So I'm like, oh, people are paying attention to me now. So
Yep.
it's
and it's funny you should mention it. Look at that rise in electrodermal right now. So, now, can you feel that in the body yet? Can you feel that? Where is that?
I mean, I guess I can feel my heart rate when the tension is off me, and then talking now I'm less aware of anything
In the body.
Yeah, so it's almost just like I'm aware of, oh, okay, trying to be calm, and now not aware of anything, no idea, like.
And what does that say?
Right, so that's now, okay, now I'm engaging, now I'm not actively trying to keep myself calm.
Right.
So I mean, I would say I'm now going back up to normal, the
Okay.
whereas before that it's
Okay.
like, okay, no, now I'm trying to be
Trying
calm.
to, yeah, okay, great. So now you're coming back up to normal what feels like a normal state
Yeah.
for you. Okay, you can hear that chime now is also on your electrodermal. I could switch that over to heart rate. You got some nice high HRV in here. Look at that. I've been to 10, 12 over here, 7 or 8. So that's looking nice. And over here, heart rate proper is the pattern is going down slightly as you were talking. So as you talk about a normal pattern, I'm trying to look and see what physiological measures might verify that or corroborate that. And we say, well, look, her actual heart rate is dropping as she's talking and explaining, what's happening, even though we see this electrodermal, that is shot up. So if each person has their own physiology, each person may respond differently from the person next to you. That's why it's so important to look at each person's individual response. Someone else may have had that increase in electrodermal, and their heart rate might have shot up too. Okay, and you might work with that person differently than you work with the person whose heart rate is dropping, because that's going more into a normal, your normal mode, your comfort zone, as that heart rate drops. So the nice thing about seeing this in real time is we can see what direction we're going as we're improvising the music or playing the drum or guitar. In fact, it's almost time, I think, to do that. Playing a piano, we'll be able to see what's happening and hear what's happening in real time.
May I ask a question?
Yeah.
To make sure it's clear, each individual person's measurements may vary under different, like under stress. Some people's heart rate may go up, but then other people's may not, but their the galvanic.
Galvanic skin response. Not everyone does not respond the same. I've been doing this a long time, and I've not seen, there's some patterns. A lot of times you'll see a pattern that many people you might notice, but there are certainly many, many times where you see a very different pattern from what you might expect or what you might have thought might be coming up. And some people have different associations with different music. One person, we put on this nice Vivaldi piece, and you see this drop in blood volume pulse. Like it hit the bottom, and it's like, what the heck is going on here? And then she turns around and says, no, not that. That's the piece that they played while I was getting my chemotherapy. And it's like, so each person has a different response. We might put on something I think is a great, nice, relaxing piece of music. That, this is great. And someone else, their blood volume drop like a rock. So it's important really to be able to gauge your client, be able to see what's happening with their body while you're delivering this music or music treatment if you're doing live or recorded. It's very interesting. Okay, let's see if I have anything else. Oh yeah, so let me see, I might be able to get one of these examples before we get into this. I'm going to turn off the sound here. And no, I wanted that. Let's see if we can hear this example. If someone, let's see if the time is back, it's not the one I wanted. Let's try a third one down. Yeah. Live piano playing with someone's physiology. live piano with live physiological response to electrodrome. There's a couple of my Montclair students. All right, so now we can do that too. We have a piano player. Come up. Do you want to continue, or do you want to pass it off? Well, it looks like we're about to pass off time right at the end of this series here. And as soon as I turn to you and ask you, see that little bump in electrodermal. So do we have another volunteer that would like to come up and have some physio and piano? Thank you. Probably not looking at the screen, looking out or toward the piano. Yeah, be careful with the floor. Make sure we're not. And the other thing we're going to try and do here is swap the video to the big screen. Voila. Just in case any of you thought VGA was hot swappable. Let's see, okay, we got a HRV coming in at 719. We have our electrodermal, that's EDA by the way, not GSR. Heart rate, 66. I'd like to start with just start with silence and see where his levels fall, and then we'll add the tone in and our improvising piano player. And just see if there's a good chance that the locked D minor box can check out. But I could uncheck it and then it'll go to chromatic. So the idea here is that we're looking to see him stabilize out. We want him to acclimate to the room and being up in front of everybody and start to feel comfortable being where he is. And we'd like to see that top graph steady out. And then here we just saw a nice spike in HRV, heart rate variability. We want to find a tone that we think might work for him. So why don't we try a couple out? You tell me what tone you like for your physiology. We've got a couple that we'll start with the one that the default that comes in here. Let's see if we can hear it. I don't know if we're still. Maybe we should still be wired for sound. Okay, that's not the default. So there's that kind of chimey kind of thing. This one. see how that compares to see if you like that crystal or if you like this warm pad. Bring it back a little more quickly now, so we can hear. Okay, either of those good for you? We want to try a different one.
That's fine.
It's fine? Okay. And, alright, we'll go to our trim. Just a little bit of an increase here, nervous system activity. We'll just keep an eye on that. And let's see. We'll give them another 30 seconds or so, and then you'll come on. You come into the piano right at the beginning of condition 2 here. interesting. We see this drop in heart rate during its silence after the music. Steady drop every 2 seconds. Heart rate dropping. Heart rate dropping. Heart rate variability increase. Okay. Turn the sound off for a second. All right, and go back to our track. Okay, so would you like to say anything about what your experience was? Or how did that feel? What was that like?
Yeah, I think it was good.
Hmm?
Not really.
Didn't really know this much of anything?
Well, I was looking at the piano on the screen.
Okay, that's fine. And did you feel like there was some connection, or was there, did you enjoy it?
It was nice listening to the piano.
Nice listening to piano. And how was that? Was that a different style of piano playing for you?
Yeah, I've accompanied a lot of people in the past, but never sort of like in a biofeedback way.
So you've accompanied other musicians playing their instruments.
And singing as well.
And singing, but you haven't accompanied someone's body before.
Right.
Really good. First time for everything. Are you a music therapist?
No,
Oh, okay.
I'm a writer.
A writer.
But I do piano on the side. So.
Okay, great. Oh, nice playing. So, everyone has their own style of playing, of music playing, their own piano style, their own interaction style, and improvisation style of improvising with another musician, improvising with your fellow players, and now improvising with someone's body at the same time, playing musically. There are different ways to do it. There's no right way, there's no wrong way, but there are explorations. I gave a couple of suggestions to try out in the middle. Do you remember any of them?
Oh yeah, no, it was really great when you told me to space it out more.
Sure.
I
Try to
was-
add space,
Yeah.
add silence, so that allows the other person to be heard and where they're at to come in, and then it gives you something to play off of, to respond to. Yeah, that was one. I thought that worked out nicely.
Yep.
Very well with that. Yes?
Is our patient a musician?
You a musician?
Not now. I don't have time to do this.
Doesn't have time for
Not
What
recently.
do you do?
Not recently. Oh, okay. Oh, it gets deeper. Not recently. So, a past musician?
Somewhat.
Somewhat. All right.
Because
What instrument did you used to play?
Mostly just piano and violin.
Piano and violin.
Barely violin.
Okay.
I wondered if we didn't see his heart rate go down so much because you were paying attention, like you were maybe engaging more with the music, like what's going on with the music, than being a recipient of a therapeutic treatment. Or, I don't know if you were maybe more analyzing or
Can you-
engaging in that kind of a way.
Can you go back to what your process was a little more, like how you were engaging? And you mentioned that you enjoyed the piano playing. Was there an analytic process going on too, or was it a meditative process? What was happening?
Well, just trying to remain calm and listen. Thinking of just things that the music reminded me of.
Imagery? Okay, yeah, interesting point. Good question. Because what's going on in the client's head will have a lot to do with how the body's responding. Oh, great. Thank you very much. Round of applause for these guys. I think we'll do some questions now, and then I want to see if we can demo the latest hot off the press native flute feedback. See if we can get that to work. But after we talk a little bit or hear what you guys are interested in at this point, this is kind of an exploratory, improvisational part of the session. So if someone has questions, or if someone wants to come up and try something and has an idea for seeing some of this stuff, we can go that route. We can get off of this screen.
I have a question.
Okay.
You said you can set up a system with monitoring and putting it on the screen on the cheap. What would be a recommendation for the cheap?
For cheap?
Mm-hmm.
Well, cheap, I mean, one of the reasons why I was working with mind drives is they're sort of old and cheap, a few $100 you can get a mind drive. There are other cheap systems, if you look online.
I know I'm not asking you to sell something.
No, I'm not selling anything.
but I'm just saying, what are some ideas?
I mean, there are EEG units, if you like EEG, that that are a few $100, $300 or $400. Some of it depends on who you're working with, what you want to be getting at, what kind of physiology you want to be measuring, what client population or pathology you're interested in. It's hard to find a cheap machine that does everything. I mean, there are expensive machines that'll do everything. They have modules that you plug in and you can get.
Well, what about like just a sensor like you have there on the scanner?
Yeah, these are relatively inexpensive. Talking a few $100. Yes?
Have you done any work with functional MRIs?
I haven't, but I'm very interested in it.
Yeah, that's not so cheap.
Not so cheap, yeah. Not so cheap
It
technology.
would be so interesting to see.
Absolutely. You see real-time fMRI,
Yeah.
to music and music improvisation. Absolutely.
Is it-
Definitely a wave of the future.
In your research, do you know anyone who has done that yet?
There's a guy in Montclair who's doing some fMRI stuff. He's kind of secretive though. It's hard to catch him. He's never in at his office hours. I had to track him down. When he was talking with a student in his office, I'm hanging outside the door. Hey, can we talk a little bit? There are people doing it. Arthur, do you have any ideas on people doing fMRI music research?
Because in Texas, there was a fellow that presented at one of the medical conferences using fMRI.
Okay.
I think his name. Sorry, it doesn't
All right.
come back.
Well, it might come back sometime. Yeah. Other questions, ideas, responses? I've got a video here actually we didn't get to see that responds when a client is under a threshold. So you see this video image continuing to animate. And actually the BioExplorer program that I use, the different software, is very good with that kind of thing. Yeah.
I was just going to ask, as a music therapist, are there clients that this is useful for and effective for, and others, like I'm thinking of the dementia, Alzheimer's clients, that some would and some wouldn't.
Exactly right.
All right.
Some would and some wouldn't. But it's interesting. I talk a little bit in Bioga music therapy. In the book, I talk a little bit about hemoencephalography, which there's this headband that you put on, and kind of like the pulse ox or infrared technology, where you can get a heart rate, or you get a percentage of red coming back at you, so you know how much blood is flowing. You get the hemoencephalography that points in this frontal or prefrontal realm. And there have been ADHD studies and Alzheimer's studies using hemoencephalography. And so that's one modality I use. If someone can tolerate it, if they can tolerate the band, autistic too. We had some very good response with there was a pilot study at the Philadelphia Academy Charter School I was working as a consultant on, and they were working with ADHD kids and autistic kids, and found that there were a good number of the autistic kids that responded to it's kind of like the ritual of having this thing on their head and then having it respond to them, and they would try and play, get points on the software. They would play for points, and they would get very into trying to raise their HEG, raise the cerebral blood flow, which presumably would help with brain functions if you're having more blood flow and more, metabolizing more nutrients in the blood, that good things might happen. And they were able to respond well, and some of them showed some nice improvements. And I don't know whether statistically whether they got on that site. It started out as a study, and then it kind of morphed out of a study into kind of like a clinical experiment, pilot kind of thing. But yeah, for seniors, a lack of blood flow is is an issue with Alzheimer's and senior function. So if you can increase brain blood flow, there's a chance that you may be able to help with some symptoms. Questions, thoughts, ideas, brainstorms? Okay, well, in that case, we'll bring up our last experiment, maybe the last experiment. We'll have someone to sit in this chair. Probably, I don't think I won't try my luck with hooking up EEG now. Save that for later. We'll go with the same setup and see if we can bring in the brief native flute phrases going up and down as feedback rather than a straight synth tone. So we have someone that would like to give that a try. I'd like to come up and experience that. Sure. Around to the front. Okay, so just sit naturally and move. Yeah, that's good. But not connected with the other hand. Keep that separate. And that's good. All right. And we've got heart rate over here on the left. We've got electrodermal response here. Look at our meters.
Heart rate and EEG levels.
Nice HRV, 8.35. Volume pulse. Trend. Reset. Stop. Reset. So, there we go. You can also save data as a text file, so you can import the data into Excel or more sophisticated analysis software. Just seeing a trend graph. So we'll take a couple minutes here of a little bit of baseline, see where your levels are falling, and then we'll give you some flute feedback.
I have a quick question.
Yes, yes.
Do levels change according to the times of day, like in the morning, in the afternoon, in the evening?
Yeah, again, each person has an individual response. And one person that may have a high EDG or HRV in the morning, for someone else, the person next to them might be very low or not responsive. So I always say you have to look at the individuals in front of you and work with them in the moment. What you're getting back. Great question.
And that would be the same as for weather conditions, like
Sure.
rainy, cloudy, or sunny or something.
Absolutely, and weather can certainly affect the physiology in the body. Whether it's allergy season, body's releasing histamines, all that kind of stuff. Absolutely can have an effect. The one that what I emphasize more though than the day to day or the session to session is really what is happening within session. Can you lower that EDG at will within session? Can you bring up that HRV? How do you interact with the music? As a music therapist, how do you respond to increasing HRV, and how can you create a pattern, a musical pattern to move someone, to nudge someone in the physiological direction that you'd like them to be moving in. Okay, so here we see a little up, a little down, a little up, that's all right. Nice HRV here. Let's move over to a meditation screen. And this synth bed I like works pretty nicely under the fluid. Let's see if we can bring that up. I think we lost power. Lost the power supply. Do we have sound? So now instead of the long synth tones that we heard coming back while we had our piano and former musician playing on the body, we now will have live flute if this new latest and greatest gizmo works. In the background. Let's see if I can bring up the flute facing away from the screen. Just close your eyes. See if you can listen and imagine that your body is playing that flute. And you know that as the flute starts to come down, your body is relaxing. Your nervous system is calming. Feel free to breathe. There's a nice love. here, the last 2 minutes. Look at that decrease in electrodermal activity, increase in heart rate variability. Very nice relaxation trend here that I'm seeing. So you can so tell us what did you notice?
I felt like I was relaxing, and then when you were telling me to breathe differently, I had to wonder what was going on up here.
Well, you were relaxing a little bit, and a nice HRV in here actually. You had some little spikes, but when I asked you about gave you some guidance on the breathing, you really brought it down. The electrodermal just sort of dropping much more quickly below that line. So, did you feel any different in the body? Was it more of a mind process going on, wondering, well, gee, I wonder what the heck is going on that screen, and well, why did he tell me that? And was that still going on, or were you able to let go of that?
I was able to let go.
Okay.
But I felt actually I was breathing through my nose almost the whole time, and then when you asked me to exhale through my mouth, that felt strange. So I didn't know if that would make any difference.
Need some further research to see if that would replicate or not. But we see at the end, we see that nice relaxation pattern. We see that high HRV in this section here, from here through the end. Here your electrodermal is kind of up and down, up a little bit and down, and kind of spiky, and then here we have the pattern here. Here's heart rate proper over here. What was it like getting the fluid's feedback?
I liked it.
I liked it.
Yeah.
I think I'm really excited about that. I don't know that anyone else is doing that at the moment, but I think it has a lot of potential to bring a real instrument in as the feedback, moving up and down. It really creates a much more musical aesthetic and sensibility. But yeah, Alex.
Cameron Fowler in New York is using music as feedback and neurofeedback training. Has been for a number of years and finding it highly effective.
Okay. In short phrases, as the feedback, or it's
in longer,
like on-off kind of
duration,
thing.
on-off.
Right, like threshold turns it on.
Right.
Yeah.
I like the idea of the individual instrument more so.
Yeah, a bunch of people are doing neurofeedback, doing threshold on, and you get this nice environment tone, or it changes as another measure hits a threshold. I like BioExplorer is a great software package for that, for doing that kind of thing. All right, we're getting near the end here. Questions, comments, experiments, and we might be able to wrap up a few minutes early. Great, well, it's been a pleasure and honor to be able to talk to you and have be here at University of Georgia at this conference, and thank you very much for attending. And thanks to all our volunteers. We'll be talking, Clinton and I will be talking more about Native American flute tomorrow morning.
How's it going? So I'm actually covering this conference for CNN.com. So I'm going to be writing a couple of articles about music and medicine. And, yeah.
Great. You're a reporter and a piano player.
Yes.
That's awesome.
That was a really cool experience. Like, I've never done that before, like listening to somebody's biofeedback.
Wow, that's really cool. That's really neat.
Oh, thank you.